Knowing that malnutrition is high among intensive care unit patients, the ICU nutrition research team was eager to improve the nutrition and clinical outcomes of our critically ill patients. Providing them with the right nutrition at the right time improves wound healing, boosts the immune system, and helps the gut work more effectively, which altogether improves the chance of surviving critical illness. While investigating studies in this field, the team discovered an international nutrition survey focused on improving the practice of nutrition therapy in the critically ill. The study was time-sensitive, requiring data to be collected over a defined period from a specific number of patients. The team committed to 4 months of chart reviews and submitted data on those patients who met the criteria for the study. On their own time, the team members completed continuing education courses to expand their knowledge of nutrition in the critically ill and passed the qualifying exam for certification. Participation in the study has resulted in a benchmark performance report card for Bluewater Health that highlighted our strengths and identifies opportunities for improvement in nutrition support. Based on the results, the team researched early nutrition interventions to improve the delivery of feeding and identified for implementation the PEP-UP protocol to promote an aggressive approach to providing nutrition, shifting the paradigm from reactionary to proactive. The team presented their findings to the critical care team, where it was positively received, and are now working collaboratively to implement the recommendations of the protocol in ICU. The Influenza Protection Policy Task Team came together in late 2012 to look at ways to protect our staff and patients from influenza. With the previous year's vaccination rates at just over 50%, there was an opportunity to reduce the risk of spreading the flu at the hospital. Best practice literature widely acknowledged that the best method of protection for both patients and staff is annual flu vaccination when combined with excellent hand hygiene policies and environmental cleaning. After researching the evidence and the policies in effect elsewhere, the multidisciplinary team developed the new Influenza Protection Policy for patients and healthcare workers. The policy required that all members of the Bluewater Health community would choose between the annual influenza vaccine or wearing a mask in patient care areas throughout the flu season. The team undertook this challenging and culture-changing work, recognizing the need for staff choice and that protecting our elderly, very young, and immune-compromised patients is a central part of our commitment to safe, patient and family-centered care. Leveraging each team member's strengths and skills, infection control, occupational health, medical affairs, human resources, and communications all had vital roles to play in the consultation, creation, and implementation of the policy. With internal support, vaccination rates reached a new high. This made Bluewater Health a leader in the province, with organizations now looking to us to share our success. To empower our people to be the best they can be, the Innovative Management Development Team created a training program for new managers at Bluewater Health. Transitioning from frontline employee to a manager can be a daunting journey, and traditionally there had been little formal training during which managers could gain the corporate knowledge and new skills they may require in their expanding role. This team was a champion of change. They recognized the need for this crucial learning and developed a program with clear learning objectives. Each session was designed for a specific topic, including lean, human resources, project management, critical thinking, finance, and communication. Each module addressed issues that managers are faced with every day, so not only was the information invaluable, participants had the opportunity to apply it immediately. The team demonstrated a commitment to exceptional care by giving managers the proper tools to be leaderful. Managers learned how to facilitate and encourage a positive work environment by developing and engaging our frontline staff, encouraging staff to be the change they want to see, and utilizing project management tools to facilitate change. Internal experts presented students with theory, group activities, open dialogue, and tutorials to help reinforce learning. These sessions also gave the first 11 graduates the opportunity to meet and get to know the important resource people within our organization and to forge working relationships with their peers.